Hello, welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of June 28th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. Alameda County now has 90,103 COVID-19 cases and 1,277 COVID-19 deaths. And for the first time, that number has not moved since I reported last week. In terms of vaccination, over 80% of 12-year-old and up have had at least one dose, and 67.8% are fully vaccinated. Oakland as a whole is not far behind, with 79% and 64% respectively, but we still are seeing wide disparities with some of our East Oakland, Hayward, and unincorporated areas being under 60% fully vaccinated, while other areas of the county are up over the 80%. But the good news is all areas are continuing to increase, some more slowly than others, but they're all increasing nonetheless. In terms of cases, we are still fairly nice and low. However, wanted to point out that we are continuing to see a little uptick in terms of the 7-day average for percent positivity of tests. And actually, as of this morning, this is even a little higher at 1.3% positivity. And we also are having just a little uptick in the number of hospitalizations. So it remains to be seen whether this will sustain. But of course, with so many of the restrictions having been dropped after June 15th, we do expect to see somewhat of an increase, and hopefully it will just be limited by the fact that our vaccination rates are so excellent. So today we want to talk about children, particularly as it relates to COVID-19 and the vaccination, and with these new reports around myocarditis. And so we'll get into some detail in that. But first, we know that in general and on average, children do better when they catch COVID-19 than adults. Still, with all of the changing dynamics, we really need to keep evolving our understanding, because remember, in the beginning of the pandemic, we didn't think it affected children at all. We have since learned that that is not the case, and we are seeing changing dynamics with good vaccine coverage for adults. And so we really have to keep our eye on how things are changing as we progress. And so right now, what we're seeing is that the majority of new cases, if we look across the country from April to June, the majority of new cases are actually among adolescents and young adults. And since the onset of the pandemic, there have been at least 7.7 million people aged 12 to 29 who have contracted COVID-19 in the United States. This graph, I think, shows nicely the increasing proportion of cases that adolescents and young adults make up. And you can see it just increasing as those older adults up top have gotten vaccinated. Their incidence of new cases keeps getting smaller. And here you can see that in the 12 to 29-year-old age group now, their cases make up 33% of the total. When it comes to recent hospitalizations, we're actually seeing hospitalization rates coming down with the older age groups, but it is really staying the same among 12 to 29-year-olds. And so again, as others kind of start to do better and get more protection, now we are certainly shifting our attention to the other age groups where the hospitalization rates are actually staying about the same. So we'll need to be keeping an eye on that. In terms of deaths, since the start of the pandemic in the United States, there have unfortunately been 2,767 COVID deaths in children and young adults aged 12 to 29 years old. And the other big concern with children, as I reviewed here in detail in the past, is MIS-C, which is multi-inflammatory systems uh, disorder in children. And this is a very serious post-COVID condition. There have been over 4,000 MIS-C cases in the United States, and 60 to 70% of those young people who get MIS-C actually go to the ICU, and 1 to 2% die. And of note, about 62% of children who get MIS-C are Black or Latino, and it is still unclear why that is. So that is sort of the backdrop that we are dealing with, where COVID is not benign in children and becoming actually an increased concern, especially as the younger populations are less vaccinated and we have new variants whose impact is really yet remaining to be seen on everything, everyone, but on young people in particular. So, the first reports that we got about myocarditis after the mRNA vaccines were actually out of Israel. And the data from Israel, remember, Israel was kind of first out the gate in terms of vaccinating. They are using mRNA vaccines, and they are one of the most fully vaccinated countries on the planet at this point. And what they reported was that they found 148 cases of myocarditis that occurred around the time of vaccination, mostly in younger men, age 16 to 19, and mostly after they got their second dose. Most of their cases were hospitalized, but for a short period of time, and they say that 95% were considered to be mild cases. And so in Israel, they determined that the risk for complications from COVID itself outweighed the risks that are posed by any vaccine side effects, including this one of myocarditis. So the first cases were reported out of Israel. There was also some reports out of our military here in the United States, and there were reports from our VAERS, our Vaccine Adverse Events Reporting System. And so that led the CDC and the FDA to take a closer look. And they also issued this statement here about myocarditis and pericarditis following mRNA COVID vaccine. And you can find that on the CDC's website. And it goes into just a little bit more detail about what they found and what they're currently recommending. So earlier this month, the VRBPAC, the Vaccine-Related Biological Products Advisory Committee of the FDA, met on June 10th, and ACIP, the Advisory Committee on Immunization Practices, met on June 23rd to review the safety data and the cases of myocarditis and pericarditis to date. And here's a look at their agenda. This was over a 5-hour meeting, which again was about a week and a half after the FDA's 7-hour meeting. And this was actually one of the main topics that was taken up in both of those deliberations. So the ACIP reviewed data from Israel, from the Department of Defense, and from the CDC and the FDA's various safety surveillance systems. And they presented on all of this and really focusing on safety. And they then had a discussion about the benefit risk balance for COVID vaccine in adolescents and young adults. So briefly about myocarditis. This is a condition that we know about. It's not common, but it's also not new. Myo meaning muscle, card meaning heart, and itis meaning inflammation. Myocarditis is an inflammation of the heart muscle. Pericarditis has also been reported, and this is inflammation of the lining around the heart. And typically, this is less concerning than myocarditis. It has been reported also after the mRNA vaccine, but it can also occur together with myocarditis, and this is called myopericarditis. So this is not myocardial infarction. This is not a heart attack. This is an inflammation of either the muscle or the lining of the heart, or both. And in general, actually, just unrelated to the vaccine, just in general, myocarditis is actually most common in people under 18 years old. And it's also more common in boys. Once you get over 18, the incidence of myocarditis begins to decrease with age. Treatment usually is supportive. Sometimes it doesn't need any treatment, sometimes just over the counter treatment. Sometimes it does require hospitalization and prescription therapies. And sometimes it can be very severe, not usually, but it can. And myocarditis related to the vaccine is most common in those under 30 years old. So most of the focus again here is on 12 to 29-year-olds. And in most cases, those symptoms come up within a few days of dose number 2 of the mRNA vaccine. The early data so far is showing that most people who get myocarditis after the vaccine are being hospitalized, but usually partly out of an abundance of caution, partly because the symptoms can be severe and we want to be as cautious as possible. But even in those hospitalized, many of those are considered mild cases. They have short hospital stays, and so far their outcomes have been good, but it's still very early. We don't have long-term data yet. And so right now, the charge of these regulatory bodies is to determine what is the benefit versus the risk for this age group, given this situation with a small number of myocarditis cases. So the way they do this is actually pretty complicated. I won't pretend to understand all of the way that they do these analyses, but basically they have a way of calculating based on how the COVID cases are going, how the hospitalizations are, how effective the vaccines are, how many people have been vaccinated so far, and what is the overall risk of getting myocarditis versus what is the level of protection that was afforded by the vaccine. And they look at about a 4-month risk period, and they're able to come up with sort of an assessment of the benefit versus risk in numbers. And so this chart is showing for every million doses of mRNA vaccine given, and this is using the current United States exposure risk. Now remember, these are averages. So when you get in particular areas, it could look even more beneficial because some areas have higher case rates. And in that case, the risk will be higher, whereas the risk due to the vaccine basically stays the same. So what you can see here on the left is the COVID-19 associated hospitalization that are estimated to be prevented for every million doses of mRNA vaccine. And you can see it here by age group. And so, of course, as you get into the older age groups, then you can see that the number of hospitalizations prevented by the vaccine is very high, and the cases of myocarditis are very low. And so, again, the focus ends up being here, what about in these younger age groups, 12 to 29, which have a little bit higher risk of myocarditis and a little bit lower risk of hospitalizations, but you can still visually see here that we are preventing by orders of magnitude COVID-19 associated hospitalizations with the vaccine in exchange for a few cases of myocarditis, which by and large have had good outcomes. And so this is drilling down a little bit on the 12 to 17-year-olds, because that is the group that we're the most concerned about, because as you can see, by comparison, it is preventing less hospitalizations than the other age groups, and it has, compared to other age groups, a little bit higher incidence of myocarditis. So the desire here is to drill down a little further into the 12 to 17-year-old age group and do a deeper analysis. And so here you can see some of the predictions that they were able to come up with, again, for every million second dose vaccinations given. And you can see that in girls, young women from age 12 to 17, that by giving 1 million doses, second doses, we're preventing 8,500 COVID-19 cases in this age group, preventing 183 hospitalizations, preventing 38 ICU admissions, and preventing 1 death. And within that group, we can expect to see about 8 to 10 myocarditis cases. In boys, young men, 12 to 17, we would be preventing 5,700 COVID-19 cases. You can see the hospitalizations prevented is a little higher, and the ICU admissions prevented is higher as well. And this is because, for reasons we don't fully understand, males are having a harder time with COVID in general, with higher hospitalization rate, higher ICU rates, and higher death rate. And this is actually true in just about every age group as it relates to COVID-19. And the risk of myocarditis also, again, higher in this age group for boys or young men, with 56 to 69 myocarditis cases per million. So we go from 8 to 69 cases of myocarditis per million vaccinations. And these are, again, the second doses. And so this is still a relatively small number. And again, with the good outcomes that in general we are seeing with myocarditis, this is really thought to be a small risk to take compared to how much benefit there clearly is. And when you go to the older age groups, the benefit just keeps getting better and better, and the risk keeps getting smaller and smaller. But this was the age group of greatest concern. So this is the one I really wanted us to focus our attention on today. And so even with this age group where we see a little bit higher risk of myocarditis, we are still preventing quite a bit of disease burden. The other thing I wanted to point out here is this does not take into account the impacts of long COVID, the impacts of the variants, which are sort of still yet unknown, and even the risk of MIS-C, because that is considered a long COVID. It's a post-COVID actual syndrome. So this is really only about the benefits as it relates to the acute COVID infection. And so when you add those things in, and those are even more difficult, I think, to calculate, but if you were to add those things in, then we see that the benefit, it goes up from there. So the FDA essentially decided to add some warning language to the literature that accompanies the mRNA vaccines, and that is the literature for both the healthcare providers as well as the patients, parents, caregivers, etc. And it basically describes the warning of reports of increased risk of myocarditis and pericarditis, especially after the second dose, with an expectation that the symptoms onset is usually within a few days of vaccination. So part of the guidance that's coming out has to do with those who get myocarditis or pericarditis after their first dose of the mRNA vaccine. And this is where it really does have to be a conversation with the physician to see if the second dose should be delayed or deferred. And I think we are going to be really monitoring and watching for more data to be coming out to give us guidance in this area. Other than that, the guidance is still very clear that getting vaccinated is the best protection we can get. But we want you to be on the lookout for symptoms of myocarditis and pericarditis. And those are chest pain. It can be pretty severe chest pain, shortness of breath, or having a very fast heartbeat, fluttering or pounding heart. And so these are all symptoms that typically are happening within a few days of the vaccination. And in majority of cases, it's after the second dose. So if any of those symptoms happen, seek medical care immediately. And definitely make sure that with this or any other symptom that you encounter after the vaccine, that you report it to the VAERS system, because remember, this is a huge repository that actually gets mined on a constant basis to find things like this and see if there's any early warnings that need to be put out like this. So it's really quite remarkable that we are able to detect when there are even these small numbers of adverse situations. Part of that is due to all of these reporting and surveillance systems, which we should all do our part to participate in. Now, what else can you do? Well, I'm going to go ahead and give my advice as a physician, that this is not actually advice that the CDC is giving, but this is just advice that I would give because right now we're wanting to be on the safe side. And so this is my opinion, that for the few days following the vaccine, take it easy. Let's have the kids just take it easy, relax. Don't overexert yourself, particularly in the few days following the vaccine. Maybe even a week, you might want to avoid very heavy exertion. And the reason being is that if you have myocarditis and you exert yourself, you can have a worse outcome. So, I don't want parents to be overly doting or freaking out about this because we know that the numbers of people who actually are getting myocarditis are quite small. But nonetheless, we should be vigilant and we should be on alert. And I would be monitoring that 12 to 17-year-old in particular, making sure that they let you know if they're feeling short of breath or if they're feeling any chest pain or if their heart is beating funny. And then you can take them to seek medical attention if that is the case. And as I mentioned, these cases of myocarditis are typically resolving very well. Sometimes they do require medication, sometimes they do require hospitalizations, but typically the outcomes are very good. And we know that the risk of getting myocarditis or other organs being affected from COVID-19 itself appear to exceed anything that we've seen here with the vaccine. But the overall burden of COVID-19, the amount of hospitalization, ICU, MIS-C, long COVID, death, in addition to concerns about these new variants, all add up to the same conclusion, which is that vaccination is still the best protection that we're going to get. And really, on a population level, because everything I've said up until now is really on the individual level, on the population level, we know that those who are 12 to 29 years old are an important part of our attempt to reach community immunity and hopefully stop the spread so that we can stop all of these new emerging variants from coming. So, on the population level, it is also important for us to keep those 12 to 29-year-olds within the scope of folks that we are encouraging to get vaccinated, both for their individual protection, but also for community or population level protection. So, COVID is still among us. We now have more contagious and more virulent strains among us. Please protect yourself and those around you through layers of protection designed to keep you safe from this very tricky virus. Vaccination for those who are eligible, and that is everyone age 12 and up. Remember, there are three main ways to contract COVID. The first and the most prevalent way is through aerosol transmission. And for this reason, we're still wanting to avoid crowded indoor spaces, particularly with people of unknown vaccination status. If you must be in crowded indoor spaces or working with the public, please use a high filtration mask, continue to physically distance, and preferably, you'll be doing more outdoor activities, or if you must be indoors, you'll be somewhere with good ventilation and without a high density of people. The second way is through droplet transmission. And for that, you need a barrier. So that can include a mask, it could be a shield or a physical barrier, and the physical distancing. Remember, droplet transmission can happen anywhere because droplets are moving with some speed and with some force. So, droplet transmission can actually happen outside. So, even though it is less likely because aerosol disperses, droplets have some weight to them. So, just be mindful of that. Don't think that just because you're outside, you absolutely cannot contract it. And the third and least common way to get it, but it's still a way, is through contact. So for this, really, hand washing pretty much takes care of everything. And in the meantime, do not touch your face. Wearing a mask can help remind you not to touch your mouth and nose, and also sanitizing and disinfecting, especially our high touch surfaces. If you get symptoms, whether you're vaccinated or not, please get tested and isolate until you get your results. If you think you may have been exposed, isolate, get tested in 4 to 8 days, and isolate some more until you get the results. If you're eligible, get vaccinated. Go see your primary care provider to get checked out for all the regular stuff: diabetes, high blood pressure, cholesterol. This is a great time to make sure that you are in the best condition you can be and to control any chronic diseases you may have. Exercise, get a good night's sleep, manage your stress, eat a balanced diet, take a multivitamin, and consider additional vitamin D supplementation. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.